The CDC issued this new report, and it looks at both deaths directly tied to alcohol, like cirrhosis of the liver, as well as indirect deaths, like injuries and certain types of cancer. It found that in just 5 years, alcohol-related deaths rose by 29%. By 2021, alcohol contributed to the deaths of more than 178,000 Americans that year. That's about 500 people a day lost because of consuming wine, beer, or other alcohol. For a broader look at these findings, we're joined again by Keith Humphreys. He's a professor of psychiatry and behavioral sciences at Stanford University. Were you surprised? I mean, this is your field of study. Were you surprised by these numbers and how much they had ticked upwards?
Sadly, I am not. We noticed during the pandemic that certain groups of the population were increasing their drinking, including drinking alone and drinking in large amounts. And also, there's been a long-term trend, although cost of living is going up for many things, it is not for alcohol. Alcohol is very cheap in the United States right now in historical terms. And when it's cheap, Americans tend to drink more, and that's where you get, unfortunately, these kinds of really tragic numbers.
And are those the principal drivers, low price and all the stresses associated with the pandemic?
Those two things are absolutely critical to producing this kind of increase. I mean, we have, federal alcohol taxes were last increased in 1991. They've been declining in real terms ever since. Alcohol taxes on craft beer and spirits were actually cut just before the pandemic. And that has always historically driven more consumption. The other point to remember, of course, is that alcohol is a legal product and therefore one that is heavily advertised.
I mean, I can't help but notice, you and I have talked many times over the years, but we're always talking about illicit drugs, illegal drugs, and policies to address those, never about alcohol. I mean, is that just like, as Orwell says, that the struggle is constantly to see the thing that is right there in front of us?
It's a huge blind spot in American drug policy. You can talk about drugs for hours, and people will mention fentanyl and meth and cocaine, which are, of course, very important drugs to think about, and they do a lot of harm. But no one will bring up alcohol. And afterwards, they may all get a drink together and not even think we're using a drug right now. And that's partly what the risk of alcohol comes from, is that those who use it don't think of themselves as using a drug, and therefore they don't worry about it as much as they should.